According to the Centers for Disease Control and Prevention, overdoses have reached epidemic levels. Anyone who is exposed to prescription or illegal opioids, such as fentanyl and heroin, is potentially at risk of experiencing an accidental, life-threatening overdose. But what happens during an opioid overdose? Due to their effect on the part of the brain which regulates breathing, opioids in high doses can cause people to experience signs of breathing problems and severe sleepiness or not being able to respond, potentially leading to death. Narcan nasal spray is the first FDA-approved nasal spray for emergency treatment of opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. As with any drug, you need to be aware of important safety information concerning its use. Please pay particular attention to the indications and important safety information during the course of and at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray was designed for use in emergency overdose situations, including emergency overdose situations outside of healthcare settings by not only first responders, but also in an opioid emergency by loved ones, friends, caregivers, and others without specialized medical training in accordance with the instructions for use. Narcan nasal spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. When Narcan nasal spray is administered to a patient with signs and symptoms of an opioid emergency, naloxone molecules travel through the body to the brain. Naloxone molecules attach to the receptor sites with a greater affinity than most opioid molecules. By displacing the opioid molecules, naloxone can rapidly reverse the potentially life-threatening effects of the overdose, specifically respiratory depression. If the person does not respond by waking up to voice or touch or breathing normally, or the signs and symptoms of an opioid emergency have returned after Narcan nasal spray has been given, give another dose in the alternate nostril using a new Narcan nasal spray and watch the person closely until emergency help is received. Additional doses may be given every 2 to 3 minutes until the person responds or emergency medical help is received. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. Remember to always get emergency medical help immediately after the first dose of Narcan nasal spray, even if the person wakes up, because the signs and symptoms of an opioid emergency can return. Narcan nasal spray 4 mg ensures that a consistent, concentrated 4 mg dose of naloxone is delivered for the emergency treatment of a known or suspected opioid overdose. Talk to your doctor or pharmacist today. Please see indications and important safety information at the end of this video. Indications and important safety information. What is Narcan nasal spray? Narcan nasal spray is a prescription medicine used for the treatment of an opioid emergency, such as an overdose or a possible opioid overdose with signs of breathing problems and severe sleepiness or not being able to respond. Narcan nasal spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan nasal spray is safe and effective in children for known or suspected opioid overdose. What is the most important information I should know about Narcan nasal spray? Narcan nasal spray is used to temporarily reverse the effects of opioid medicines. The medicine in Narcan nasal spray has no effect in people who are not taking opioid medicines. Always carry Narcan nasal spray with you in case of an opioid emergency. Use Narcan nasal spray right away if you or your caregiver think signs or symptoms of an opioid emergency are present, even if you are not sure, because an opioid emergency can cause severe injury or death. Signs and symptoms of an opioid emergency may include unusual sleepiness and you are not able to awaken the person with a loud voice or by rubbing firmly on the middle of their chest, breathing problems including slow or shallow breathing and someone difficult to awaken or who looks like they are not breathing. The black circle in the center of the colored part of the eye is very small, sometimes called pinpoint pupils, and someone difficult to awaken. Family members, caregivers, or other people who may have to use Narcan nasal spray in an opioid emergency should know where Narcan nasal spray is stored and how to give Narcan nasal spray before an opioid emergency happens. Get emergency medical help right away after giving the first dose of Narcan nasal spray. Rescue breathing or CPR may be given while waiting for emergency medical help. The signs and symptoms of an opioid emergency can return after Narcan nasal spray is given. If this happens, give another dose after 2 to 3 minutes using a new Narcan nasal spray and watch the person until emergency help is received. Who should not use Narcan nasal spray? Do not use Narcan nasal spray if you are allergic to naloxone hydrochloride or any of the ingredients in Narcan nasal spray. What should I tell my healthcare provider before using Narcan nasal spray? Before using Narcan nasal spray, tell your healthcare provider about all of your medical conditions, including if you have heart problems, are pregnant or plan to become pregnant. Use of Narcan nasal spray may cause withdrawal symptoms in your unborn baby. Your unborn baby should be examined by a healthcare provider right away after you use Narcan nasal spray. Are breastfeeding or plan to breastfeed. It is not known if Narcan nasal spray passes into your breast milk. Tell your healthcare provider about the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Narcan nasal spray? Narcan nasal spray may cause serious side effects including sudden opioid withdrawal symptoms. In someone who has been using opioids regularly, opioid withdrawal symptoms can happen suddenly after receiving Narcan nasal spray and may include body aches, diarrhea, increased heart rate, fever, runny nose, sneezing, goosebumps, sweating, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, stomach cramping, weakness, increased blood pressure. In infants under 4 weeks old who have been receiving opioids regularly, sudden opioid withdrawal may be life-threatening if not treated the right way. Signs and symptoms include seizures, crying more than usual, and increased reflexes. These are not all of the possible side effects of Narcan nasal spray. Call your doctor for medical advice about side effects. The risk information provided here is not comprehensive. To learn more, talk about Narcan nasal spray with your healthcare provider or pharmacist. The FDA-approved product labeling can be found at www.narcan.com/pdf/narcan-prescribing-information.pdf or 1-844-4NARCAN. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including the patient information for Narcan nasal spray.